अजून पण जॉईन झालं नाही, त्यामुळे सेट व्हायला टाईम घेऊ शकतो आपण. I will share this link on that page. चाहिए Start.
I am Dr. Chandrika and we are the 2023 batch. Our DGO final theory and practical exams. So this channel is of our junior Dr. Prathamesh. He requested us to tell a few things about the final theory and practical exams and how the course will be. So before we forget the things, so we are starting this video session now. Yeah, firstly, I will congratulate everyone for taking this course, and I know you will get few questions like why you took DGO, who is doing DGO now, like that questions you will get. And trust me, degree is not important. At last, how you are approaching the patient, and then your clinical skills and your ethics towards the patients, and how you respect your patient. That only matters. Few friends of mine are there who did only DGO and they didn't do any secondary DNB or further fellowships, and they are in good position doing jobs and they are getting equal salary to that of the MD and DNB people. So with this we will start our today's session. Like I don't want to be monotonous, so my friend will be asking questions. Like she will be sometime first year, and she'll be asking some questions and we'll be discussing them. Yeah.
So, ma'am, when they will conduct FAT exams?
It depends upon the year. We got very late. We gave our exam very late. We got our FAT theory date 9 months after our joining, and our seniors got 6 months after joining. So it totally depends upon the NB. Don't be worried about that much. You will get your date 1 week prior the exam, FAT theory exam.
So, thoroughly we should practice or we should read for FAT and when exactly we should start to read it?
Ideally, it's better to start from first day. Like whatever cases you will be seeing in OPD, in your wards or in your OT, just you once you reach the room, just you go through those topics. It will be helpful to perform well in your FAT and in your final exam. But it's not late. You can start now also for that.
So, basics will be enough or we should go in detail to read the topics or questions or answers?
Trust me, basics are more than enough for your final exam also actually. Other than basics, they won't ask anything. But the point is that many of us doesn't know what is basics. Basics is like what you will see in daily OPD cases, what you will see in OT, and what you will be seeing in your ward. Other than that, nothing they will ask. Like whole exam will be, whether it is theory or practical, will be like how you are approaching the patient and how you are treating, how you are examining the patient, and what investigations you are writing. Mostly it will be clinically based.
Marks will be added in final exams of this FAT or just for practice it will be?
You should be just attending the FAT session. Whether you pass or fail, that doesn't matter. So only attendance is important, and you should be carrying your logbook, which you will be maintaining from day one of your exam of your course.
Okay, and how it will be useful for final exams?
Yeah, it is just your FAT exam is just replica of your final exam. Like it totally depicts the pattern of your final exam. So it will be of totally 200 marks. In first paper, you will be having OBS, and second paper you will be having gynae. In FAT, you will be recent advances, embryology, basic physiology. This can be asked in any paper, and you will be having some few SPM questions. SPM are community medicine questions, because both the DNB second year people and diploma people will be writing the same exam for FAT. So you will be having some SPM and community medicine questions. Don't be worried about that. Don't get panic by seeing that questions. In final exam, we won't be encountering such questions.
And what about logbook? They will tell to maintain it. So they will ask in FAT exam also or only this for FAT exam? Sorry, final exam.
Logbook will be asked in FAT exam and in final exam also. You should start writing your logbook from the day one. But it
And
won't carry any marks in your final or in your FAT exam also.
okay. Okay, I thank you for this FAT examination things. Now I want to ask about final, which is my main target. So, is it tough for to pass or to get good score?
Passing DGO is not that difficult. I, I passed, she passed, everyone will be passed. But I'm just telling that it is not difficult to pass DGO. Just you should start reading and from like start reading from day one or at least know.
Like, while having duties and all, so better to start when and how we should manage it.
Better to start from today actually, like daily at least half an hour, 1 hour you start reading. Like whatever you see in your OPDR, OTR, that only you start reading. That topics only you cover, and so that it will be easy for you to attempt in FAT and final exam. Other than that, nothing like that. But there were people who cleared exam by reading 1 month, 2 months, and 3 months. Just your performance will improve if we start preparing earlier.
Okay, as people say, previous year questions will matter and they will cover most of the things. Is it that?
Yeah, previous years, not previous years questions. Actually, previous years topics are important. So questions won't be repeated, but topics will be the same. So it will just give you idea like in what topics they are covering and in recent advances what we should see. That idea you will get like how the pattern of exam is there, like how they are asking questions and repeatedly in from which topic they are asking questions, that we can get from previous year's papers.
And how about theory patterns, how they'll divide the papers up and how to read?
Yeah, theory will be for 300 marks. Paper 1, Paper 2 and Paper 3. In Paper 1, you will be having your basic sciences including your embryology and recent advances. And then in Paper 2, you will be having OBS with neonatology. In Paper 3, you will be having gynec. And in Paper 2 and Paper 3, anywhere they can cover your surgical things also related to OBS and related to gynecs. In Paper 1, we will be having paper 2 will be having surgical aspects relating to ops and paper 3 will be having surgical aspects related to gynec.
And what about attending the answers, how, what they'll expect to get good score?
Yeah, you will be given a 50 pages booklet each, and you will be having 10 questions in each paper and in serial order, like first question will be having 5 papers to write and second question will be having 5 pages to write. So you should answer the questions in that allotted pages which were given to that question. That's it. And you should try to attempt every question. So I don't know whether they will give marks for attempting the question, but it won't leave bad impression. If you leave any question, that may create bad impression on the examiner's in the examiner's mind.
Okay, so they say around like if you are working under TNU and BMS, they'll give center in other states. So what about the centers and all? You will get in your state or you have to go?
You will be allotted in other state, but mostly you will get in neighboring states only. And prior day only, it's better to go to the center so that we will be acquainted to the surroundings, that you will be familiar to the surroundings, and what matters is that how you perform that 3 hours. That only matters, like 3.5 hours of your theory exam and how you perform that on the day of practical exam. That only will matter. Like it has one advantage and one disadvantage. Like there won't be previous impression on you by the like in the view of external or examiner. And but the disadvantage, so there is like based on personal grudges no one will fail you, and the disadvantage is that like whatever you perform on that day matters, like based on that only you will be passed or you will be failed.
So one internal and others should be externals.
Yeah.
So everyone is external for us.
No, the yeah, one internal of that college or our hospital will be there, and three will be externals. But everyone is new for us. Like whoever, maybe the internal or external, that doesn't matter for us.
So when we will get practical dates, it's like we should pass theory only or after like
Yeah,
after taking.
after passing the theory only, we'll get our practical date. We got our practical date on the day of declaration of theory results,
How?
and we got almost 15 days gap between the theory and the practical
So better
exams.
to start before results only, whatever the
Yeah.
thing. And how they'll conduct practical exactly?
Practical will be of 300 marks. In that, 200 marks is for cases. You will be having two OBS cases and two gynae cases, and selection of the cases will be on lottery basis. So you will be allotted half an hour for each case, and then following the OBS discussion will be for 30 minutes, and gynae discussion will be for 30 minutes. And then following that, we will have ward rounds. In ward rounds is for 40 marks. In that, we will be allotted four cases. That case can be anything, like post normal vaginal delivery, or post cesarean, or post total abdominal hysterectomy, post total laparoscopic hysterectomy, or it can be diagnostic histolaparoscopy, DNC procedure, like that.
In ward rooms, they'll ask questions about whatever the post-op cases.
Yeah, they will ask about your post-op cases, like that the student of that hospital will be there, and she will be telling the diagnosis, like post-op day 1 or post-op day 2 of total abdominal hysterectomy or total laparoscopic hysterectomy. And then they will ask, based on this diagnosis, what questions you will ask, and what complaints you will expect on that day, and how you will examine the patient. And then what if you want to rule out something, what investigations you will order, and how you will, if patient is having any complaints, how you will rectify the or resolve that complaints. How you, basically, like how you approach the patient in history and examination part, and how you will proceed further for in view of investigations or management. That is important.
And what about table viva? They'll ask like what instruments and specimens.
Table viva will be for 60 marks. Okay. In that, first we will have instruments. Instruments, it can be open instruments or normal vaginal, open surgical instruments or normal vaginal delivery instruments. It can be, or it can be laparoscopic instruments also. They will ask you about laparoscopic instruments also. Next, drugs. In drugs, you should remember like what are the basic uses of that drug, and for important drugs, you should remember the doses also. Then ultrasounds. Uh, like in ultrasounds, like molar pregnancy ultrasound can be there, or ectopic pregnancy ultrasound can be there, or like IUD signs they can keep. Basic ultrasounds only will be there. Then Doppler changes can be there, like when we will call it as IUGR, and if Doppler changes are there, IUGR, FGR, and if Doppler changes are there, when you will terminate, that and all they will ask. Then which artery Doppler is there, and what is the significance, like in case of PAH and in case of FGR, that all things they will ask. Then coming to NST, like you should start describing from baseline FHR, then whether accelerations are there or whether decelerations are there, beat to beat variability, and fetal movements within 6 hours. That all, like all components you should cover. You should be describing the NST, and you should be telling like whether it is reactive or non-reactive. That you should be telling. Then coming to CTGs, whether it is normal CTG tracing or it is having decelerations, like late decelerations or variable decelerations or early decelerations. What are the condition, in which conditions you will see the decelerations, and how you will manage that, and if it is persistent, how you will manage, and or if it is just temporary for 30 seconds, how you will manage that, and all you should do. Next, spotters will be there, like specimen. Like first you should describe the specimen, like what you are seeing in that specimen. Like for example, if it is a TAH specimen, you should describe it like now this is a specimen of uterus with bilateral tubes, like that you should discuss. You should
Post-surgery.
post-surgery, post-cystectomy status, like that you should tell like what you are seeing there. Then based on that they will ask questions, like they can ask indications, or they can also tell like they can give you a clinical scenario, patient came like this, so we did this surgery, and based on that your viva will be going on. Then what else?
Gynae USG scans also will be there. Like
Guys,
cysts.
HSG can be there. So HSG also, like different Mullerian anomalies. Based on that, they will ask questions. Then partogram. In partogram, like you should start explaining from start. Like upper part, what it consists, like fetal condition. Every component you should tell. Then in middle part, how the labor is progressing. That also every component you should tell. And in fetal condition, maternal condition, her vitals and all, every component you should explain, and then they will ask like why the patient, whether she delivered normally or whether she was shifted for section. That will be written on that partogram only, that you can see and you can tell. Then
Drugs.
yeah, then drugs. Other component will be drugs. Drugs are already told. Other
And
drugs,
mode of delivery.
instruments. You should know the what method of sterilization also you should learn in you should know in instruments. Then pelvis and skull will be there. In pelvis and skull, first basic thing is normal vaginal delivery steps and 7 gardening movements, that is important. After that you should they will, if you are telling this nicely, then they will ask about malpositions and then breech presentation delivery and different types of pelvis. And in that pelvis, like in different types of pelvis other than this gynecoid pelvis, how the process of delivery or steps of delivery in platypelloid pelvis, android pelvis, anthropoid pelvis, that also they will ask, and related complications also they will ask. And instrumental delivery, forceps and ventouse also you should know.
And in long cases, mostly it is important, like will go towards first manager or anywhere it can go. But we should know.
Some will hear the whole case, but some will just ask you to summarize the case and then diagnosis, and then how you will manage these investigations and then treatment part. And again they will ask the theory questions, like how you will manage and what will be the if there is medical management, how you will manage medically and surgical managements.
What about language? Like if they are giving in other state, if we don't know the language, what options will be there, or how will they help us?
You will be having a guide. For each person, one guide will be there. So language won't be a barrier. You can complete your writing the case sheet in stipulated time they have given.
Okay, and what
But
about
and it also depends upon the examination center actually. We got a guide for each person.
before practical? Everyone will be tensed and they'll be stressed. So what preparation or how to study at that moment before day exam day?
Before day,
What
once you should go to that examination center, so that you will be you won't be new to that place on the day of examination. You will be acquainted or familiar to the surroundings, and before better to sleep before the exam, because I feel like our mind will work more when we are at peace.
So my last question: what take-home message you want to give?
Yeah, start reading from now, at least for half an hour or 1 hour. Don't panic. Just give fat exam, and passing final exam also will be easy for you, and you will know the format by giving the fat exam. Now, passing the diploma is not that difficult. Everyone can pass.
Thank you, ma'am, for your
Thank you.
words. If you have any questions, if you want to ask anything, you can ask in comments.
How to write a long answer question answer?
Yeah, thing is like in question they will ask like A, B, C parts will be there, and they will ask whatever they need in answer. So if you answer that, the like no need to write paras or pages. Just you can answer whatever they ask. Related points, if you answer, they will give you marks.
Not like UG, whatever we want to write, we can write.
Some people will be in the idea like whatever they ask, we will start from definition and we will end with management or preventive measures. But that is not needed in diploma. Sure, short questions only they will ask. That only we should write. Based on filling papers, so we won't get marks.
Suppose you have not done any procedure in your parental hospital, and if you get that case in your exam, then how you should
It
approach.
depends how you are writing, how whatever you read, that only you can answer. If you have not performed only and basic things you know, they will understand. They will ask
Okay.
also. Some hospitals won't conduct some major surgeries. So if you don't know, they'll consider it.
For me, I got valve prolapse in my final exam. I didn't see any valve prolapse report. So they asked me the steps of valve prolapse. So I told I didn't see. Then they asked me about basic steps of vaginal hysterectomy. With that, they were fine. So no need to know about rare things. Common things what we will see in your hospital. That is it.
Which cases you got, ma'am, in your final exam?
Actually, basics only. For me, it was GDM in obstetrics, anemia, and in gynec I got prolapse and IUB, fibroid. So basics only will get. Some difficult rare cases, infertility or anything, if any specific institutes will be there, they will have that cases more, so you may get, but mostly common cases you will get where whatever you are seeing. And ops also, ops to many cases you know everything you will see. Gynec will be little difficult, that some wall prolapse or anything you won't get to know. So better start focusing more on gynec, because practicing obstetrics you are doing daily. Gynec will be difficult, so start reading those things.
Which cases you got, ma'am?
Ops, I got heart disease in pregnancy and breech. I was so tensed for heart disease in pregnancy. But they asked me on basic questions like NIHA classification, WHO classification. That's it. They didn't ask me more than penicillin prophylaxis, how you will start. And then what is your mode of delivery in this patient, and what precautions you will take in delivering this patient, like fluid restriction, like how much ml of fluid is amount. Such basic questions only they asked. In breech, and my second case is breech presentation. In breech presentation also they started from definition, like what is the breech presentation and different maneuvers what you will do in breech presentation. That's it. And then they asked me about external cephalic pressure. I know. In gynec, I got this wall prolapse. That wall prolapse is cystocy. So everything they asked me about prolapse only. As wall prolapse is difficult thing, they asked me about prolapse and prolapse under surgery of that, and how will prevent wall prolapse. They went in that only. And other gynec cases fibroid. That they asked me that WHO FIGO classification of fibroid, and then how you will manage medical management and surgical management. What are your examination timings? That's it.
Time management is important. You should start doing those things prior only. You should start practicing, start writing the things. Theory also you will get it. You will feel like it is less only because you won't write. For these 2 years also you won't write that much things. So you should start practicing. Within time you should cover it. In practical also, if you are writing cases, it will take time. So at least whatever you are writing and whenever you are taking history, you should know the things. That if you are presenting without writing also, you can present properly. Sometimes they won't see your case sheets, what you have written, they won't see your papers, but if you are confident enough and you have not written also, you can present. So take history properly, that is important.
Okay.
Time management is important in both theory and practical examinations.
which points are very much important in obs cases and gynae cases?
Actually, in gynae examination part, you should focus because we won't see that many pay patients. So that findings also differentials will be more. So you have to specific about your findings so that you will go to your diagnosis. If you are telling fibroid or adenomasis or any cyst, something whatever you're telling, your diagnosis will lead. We should lead to that diagnosis, your findings. So and obstetrics, so examination part plus history is important, like what she is telling, what diagnosis you are coming to. So focus on history, negative history. They'll ask why you have not asked, why you have asked this. So specific about negative history. Don't go for every patient PIH. Don't go for everyone about no nausea, vomiting. Specific about the things. It will be better.
Okay. If you do any major mistake at the time of taking case or at the time of presenting case, they will consider that as a big issue, or they will.
Major, it's different and blunder is different. If you
Okay.
don't know and you are talking without clues, that is blunder. You should not do that mistake in any exam, not in FAT also. So better to avoid blunders. Go for what you know, talk. If you don't know, say sorry.
Okay.
In
First
ward,
you-
in ward biology tool, like 4 cases will be there, and there you just will ask question. They will present diagnosis, and after that they will ask question. So this fiber for how much long or it will last? Like this fiber.
10 minutes for each
And
case.
for each case, how many questions they will ask?
It depends on. We can't tell like how many questions they will ask. It depends on external actually. Just first they will give you as soon as you are allotted the case. Uh, Examiner will come and that student of that college will come and she'll be telling the diagnosis. After that they will tell like if you want to ask any questions you can ask the patient. So and then after that you tell like. And then you should examine the patient. Then they will be asking you like whether you have completed your history taking and examination, or if you want to ask anything. Once we are done with our part, then they will start asking questions. Like based on what you have asked the patient and what you have examined, based on that only they will be asking the questions. For me, I was checking for DVT. So my ward discussion of one case went to DVT. Based on us only, they will be asking questions.
Actually, they want to see how you are seeing post of patients. Basically, you should like they want to see exactly how you will follow up, what you will see. If you are post OT, post of day 1, they'll ask respiratory system what you should see. Every system you should see, and exactly what you are seeing, they will see you.
For practical also, you should thoroughly read your theory concepts also, because you can't say from where they will ask you question. Like even like in ward rounds, they will be asking about epidural anesthesia and hormones. So we can't tell from which point to which point they will.
What are you planning after this clearing diploma final exam?
Yeah, we are thinking to do BD set and we are thinking to give BD set, and we are thinking to do secondary DNB after this.
Doing secondary DNB is must, or with diploma only we can start doing our practice?
Depends on your institute. Basically, DGO institute. If you got hands-on good, you can continue DGO. If you are not satisfied with your like you want to be a more perfect again, you want to be a best obstetrician, you should go for DNB.
Okay. How many cesarean section you did, ma'am, in your 2-year course?
We have done many, but still we are thinking like we want practice. Actually, obstetrics is like that. We don't know. Every case will be different. So complications we should manage, and that we want more practice.
Not only that thing, like we want to complete everything in one go. We don't want to go back and like read again and give exams again.
Okay.
Thank you, ma'am.
Thank
Actually, this all information was really useful for us. We are hoping like some you only told like in gynec examination part is important. So we are hoping like if one day if you are demonstrating that examination part, it will be useful for all over India for all usual people. It will be very useful. Since in examination part we will miss something. And during Viva, before Viva preparation, we will ask our co-teachers like in this case what exactly we have to examine, how to examine this thing. So we are hoping like for the next video we are hoping your next video. So please just demonstrate examination part of Gynec and Ops. And this session was really useful for us. Thank you so much.
Yeah, in practical exam also, like what I did from a practical exam is like I just asked the chief complaints and then HOTA, and then I started examining like main obstetric examination. Then in gynec also I did like that only, chief complaints, HOTA focus, and then I went to positive findings related to that of case. Then like if you are also you can cook up and write remaining things. So first we should focus on the important things like that are pertaining to that case, that will help you in time management.
Okay, thank you, ma'am.